Okay. Good morning. Sorry for the delay. Welcome to the press briefing of the UN Information Service in Geneva. Today is the 26th of November, and if you wonder why I have an orange scarf, is that because, as you surely know, yesterday it was the International Day Against Violence made to women and girls. And as you also surely know, we have started the 16 days of activism against this terrible scourge. I would like to remind you that yesterday the UN Office for the Fight Against Drug and Crimes put out incredibly sad figures, collective figures about the fact that a woman or a girl is killed in her own family every 11 minutes. That was the data for last year. So I really hope that you all will join us in these 16 days of activism, and you'll see me with the scarf until the 10th of December, when we will conclude the 16 days on the Day of the Human Rights that, as you know, is celebrated then. So without more talk, I would like to introduce to you our first guest, Mr. Yao Ido, who is the director of the International Bureau of Education of UNESCO, that, as you know, sits in Geneva. And Mr. Ido has an announcement to share. You have the floor, sir.
Bonjour, madame. Merci beaucoup pour la parole. Bonjour, chers collègues. Juste deux petites informations. La première est relative à quelques informations émanant de la conférence générale de l'UNESCO qui vient de se terminer le 24 de ce mois à Paris, pour dire rapidement que la conférence générale, comme vous le savez, est l'instance suprême de l'UNESCO et elle s'est réunie les 2 ans avec tous les 4 ans l'élection du directeur ou de la directrice générale de l'UNESCO. Et en l'occurrence, nous venons de réélire Madame Audrey Azoulay à la tête de l'organisation. Les États membres viennent de renouveler son mandat pour 4 autres années à la tête de l'UNESCO. C'est également, cette année, la conférence générale a été marquée par un certain nombre d'informations et de faits majeurs. D'abord, il y a eu, vous savez, depuis 2 ans, l'UNESCO est en train de réfléchir sur l'avenir de l'éducation en termes de, dans les prochaines décennies, à quoi ressemblera l'éducation et quels devraient être les axes forts et les actions fortes prises par les États pour promouvoir l'éducation pour tous. Et ce travail de 2 ans est ponctué par un rapport sur les futures de l'éducation qui a été lancé lors de la conférence générale et qui interpelle donc tous les pays à prendre des actions concrètes pour promouvoir une éducation de qualité pour tous dans l'avenir. Et ce rapport est disponible sur notre site et pourrait être partagé par mes collaborateurs. C'était également, cette conférence générale de l'UNESCO était également l'occasion de célébrer le 75e anniversaire qui a connu enregistrer la participation de plus de 30 chefs d'État et de gouvernement. Et c'était un moment fort qui a rappelé le travail que l'UNESCO a fait à ces jours et qui a été fortement salué par les chefs d'État qui ont pris la parole et encouragé notre organisation à continuer à œuvrer pour une paix durable dans le monde à travers l'éducation, la science et la culture. Un autre élément majeur à noter lors de la conférence générale, c'était la déclaration de Paris, qui est un processus de réflexion sur l'impact du Covid sur les systèmes éducatifs et quel type d'éducation devrait être mise en place pour répondre efficacement aux besoins en formation des jeunes et des jeunes garçons, filles et femmes et des adultes de manière générale. Et la déclaration de Paris a été lancée sous la résidence du président français, M. Macron, et bien d'autres chefs d'État qui étaient à ses côtés lors des cérémonies. Cette conférence générale était également l'occasion d'adopter la toute première recommandation sur l'éthique de l'intelligence artificielle, qui, comme on le sait aujourd'hui, avec l'évolution de la science et de la technologie, les sciences, l'intelligence artificielle est de plus en plus présente dans toutes les actions de développement des pays. Et les questions d'éthique sont importantes et au cœur des préoccupations de l'UNESCO, qui invite nos États à y travailler pour que, concomitamment au développement inéluctable des sciences et de la technologie, nous puissions nous assurer que les questions d'éthique et d'humanisme sont aussi considérées.
Enfin, excusez-moi, monsieur Ido, je suis obligée de vous demander juste, parce que je sais que vous avez plusieurs choses à dire et on a vraiment très peu de temps ce matin, comme j'avais expliqué à vos collègues. Donc, si vous pouviez juste...
en une minute,
merci.
La dernière information que je veux partager est relative à la semaine prochaine. Le Bureau international, nous organisons une visite d'études de ministres, des 3 ministres et de leur délégation Djibouti, Tchad et Bissau qui viennent à Genève pour rencontrer la Genève internationale en matière d'éducation et s'inspirer de l'expérience porteuse de la Suisse en matière d'éducation afin de s'en inspirer pour promouvoir une éducation de qualité dans le pays. Donc, c'est cette information que je voulais donner. Et cette visite a lieu du 29 novembre au 3 décembre, ici même à Genève. Merci beaucoup et je suis là pour répondre à d'éventuelles questions. Bonne journée.
Merci beaucoup, monsieur Ido. Et je peux comprendre qu'éventuellement, s'il y a des journalistes qui voudraient couvrir la visite des 3 ministres, ils peuvent s'adresser à votre bureau. Alors, je vois que Peter Kenny a demandé la parole.
Yeah, thanks for taking my question. Actually, I had my hand raised before Mr. Ido was speaking, and it's about a general matter. May I raise it now, or should I raise it later?
Just wait a second, because I've got 2 other people asking for the floor, maybe for Mr. Ido. Gorgi.
Bonjour. Merci. Je voudrais le remercier pour ce briefing, parce que quand même, on aurait pu lui donner plus de temps. C'est rare d'avoir l'UNESCO pour briefer le palais. Monsieur Ido, la question est de savoir, ce document dont vous avez fait état sur l'éducation demain, vous avez dit c'est sur le site, mais je pense qu'il est parfois intéressant d'envoyer directement à la presse des documents comme ça, parce que bon, parfois on fouille sur beaucoup de choses et parfois on perd du temps, et comme ça, nous, l'intérêt, il est là. Mais j'ai une autre question beaucoup plus approfondie, mais je préférerais si vous laissez vos contacts avec Madame Alessandra Veducci, elle voudra bien, et puis moi je prends le temps de faire un travail comme il se doit avec vous, et je vous remercie pour votre présence.
Merci Gorky, oui, on se fera un plaisir de distribuer les informations et aussi d'avoir les IBE UNESCO plus souvent au briefing, c'est super. Monsieur Ido, vous voudrez répondre?
Oui, juste dire à monsieur, le remercier comme vous l'avez fait, et lui dire que ma collègue chargée de communication, elle va partager le rapport sur les futurs de l'éducation et afin qu'il puisse être distribué largement. Et je suis disponible, si vous voulez, vous pouvez passer au BIE, vous pouvez faire des entretiens, etc. Ma collègue également laissera ses coordonnées et on pourrait organiser ça pour des entretiens plus approfondis. Merci.
Merci. Catherine Fiancon.
Merci Alessandra. Bonjour Monsieur Ido. Une question dans le rapport, est-ce que vous faites état de la situation en Afghanistan? Et est-ce que vous, en tant que Bureau international de l'éducation, vous suivez l'évolution de la situation en Afghanistan, particulièrement par rapport aux filles? Merci beaucoup.
Monsieur Ido.
Oui, bonjour, merci beaucoup. En effet, pas forcément le BIE, mais l'UNESCO dans son ensemble, notre directrice générale accorde une très grande attention à ce qui se passe en Afghanistan. Notre assistante directrice générale pour l'éducation a d'ailleurs mis en place un groupe, un task force pour réfléchir à quelle réponse l'UNESCO pourrait apporter pour accompagner le pays, notamment en matière d'éducation et surtout de la qualité d'éducation, et nous assurer que les programmes d'éducation qui seront mis en œuvre dans ce pays, les programmes qui respectent un certain nombre de standards, un certain nombre, qui véhiculent un certain nombre de valeurs qui sont importantes pour l'humanité et pour les filles et garçons de ce pays. Et donc, oui, nous suivons ce qui se passe là-bas à travers le siège et le BIE. Nous sommes dans cette task force-là pour justement voir au niveau de la qualité de l'éducation et des curricula, qu'est-ce que nous pourrions faire pour contribuer à promouvoir une éducation de qualité et accessible à tous les enfants, à toutes les filles et à tous les garçons d'Afghanistan. En effet, c'est un centre d'intérêt pour nous.
Merci beaucoup, Monsieur Ido. Paola.
Oui, bonjour monsieur. Je suis avec The New Humanitarian. Je voulais savoir si dans le rapport que vous allez circuler, s'il y avait des recommandations en ce qui concerne les mesures à prendre par les écoles partout dans le monde qui ont dû fermer, où les élèves ont été absents d'une éducation présentielle, et comment confronter en fait ces problèmes dans l'année à venir.
Oui. Merci beaucoup, Madame. En fait, oui. Ce rapport met l'accent utile, effectivement, leçon du Covid, et qui, comme vous le dites, pendant, on le sait, de février à mai 2020, l'école s'est littéralement arrêtée dans la plupart des pays, et surtout dans les pays en développement où l'école est littéralement fermée, et où, par manque de technologie et de compétences parfois dans certains domaines, plus de 90% des enfants du tiers-monde n'ont pas bénéficié d'une continuation de l'éducation de manière appropriée au cours de cette période. Et donc, la leçon à tirer, c'est comment construire des systèmes éducatifs plus résilients. Parce que malheureusement, nous le savons, avec le réchauffement climatique, de telles catastrophes, nous ne sommes pas à l'abri des années à venir. Donc, l'idée, c'est de savoir quelle éducation il faut promouvoir pour que si nous faisons face à une telle catastrophe à l'avenir, les enfants, y compris les tiers-monde, puissent continuer d'aller à l'école. Et la leçon principale, l'enseignement principal qui est dans ce rapport, c'est d'inviter les pays à promouvoir l'éducation à distance et pour prendre les dispositions pour faire en sorte que le curricula soit digitalisé et que les pays se dotent de technologies et d'Internet, etc., qui sont des défis majeurs pour assurer une éducation à distance aux enfants, parce que c'est ça l'avenir. Mais dans un premier temps, avant d'y arriver, le BIE, ça c'est pour citer notre exemple, nous sommes en train de promouvoir une initiative qui s'appelle éducation hybride. Parce que pendant cette période, madame, tous les pays, y compris les pays pauvres en développement, ont pris des initiatives par la radio ou la télé pour assurer une continuation de l'éducation. Donc, ce que nous voulons faire, c'est capitaliser justement sur tous les efforts qui ont été engagés dans tous les pays du monde pour assurer la continuation de l'éducation et voir comment nous pouvons mobiliser des partenaires pour partir de là et faire en sorte qu'il y ait un mode d'enseignement basé sur les technologies, concomitamment au mode en présentiel. Parce que malheureusement, comme vous savez, la pédagogie dans les pays en développement, c'est l'éducation face à face, l'éducation en présentiel. Parce que, et donc, l'idée maintenant, c'est comment avoir un mode qui allie les deux, et c'est à partir des recommandations fortes qui sont faites dans ce rapport que vous allez lire ultérieurement. Et je serai prêt à partager davantage si on a d'autres.
Merci beaucoup, monsieur. Merci d'être venu briefer, et comme il a dit notre collègue, venez plus souvent, on vous attend. Peter, I'll give you the floor, but briefly, please, because Hervé needs to leave. He has a plane to catch. So just go ahead. Thank you very much, Mr. Ido. Peter.
Okay, thanks, Alessandra. I will be quick. I just noticed that the IOM is not at the briefing today. I was asked to raise this question by members of UPES, the Foreign Correspondents Association. IOM held a briefing yesterday, the day after a high number of people were killed in the channel between France and England. And this was an exclusive meeting. Not all journalists were invited. So I would just ask that if the IOM can come here as a UN organization, which they were boasting about being, and allow all journalists to speak to them. Thank you.
Thank you very much. Well noted. I just want to mention the fact that Paul Dillon is almost every briefing on the line. He doesn't actively brief, but he's always there. Today is not, sorry, but we will bring this to him. Thank you very much. Well noted, Peter. And I go to Hervé, that before catching his plane wants to show you something. It's pretty interesting here.
Yes, I want to show you some things and to speak about this little thing that you see here. And that's HIV Auto Test. And why I want to show that one is with saliva. We have another system we work with the blood. Because more than ever, we need those tests because now with the COVID-19 situation, a lot of people in low and middle income countries are not going to test themselves in facilities, in hospitals. And we have seen disruptions and delays to HIV services caused by the COVID-19 pandemic. And that led to declines in HIV testing and diagnosis in 2020 for the first time in more than 2 decades. HIV self-testing, which has contributed to a 40% reduction in the number of people who don't know the HIV status since 2015, is now crucial to maintaining access to HIV care for millions of people in the face of new COVID-19 roadblocks. With more than 37 million people living with HIV worldwide, an estimate 6 million of whom do not know the status, receiving a diagnosis is a vital first step in accessing treatment. UNITED has led a large-scale effort to create access to HIV treatment and prevention through self-testing, with more than $100 million invested since 2015. This work has helped reduce price for self-test, generate demand, demonstrate implementation pathways, and support scale-up across 14 countries in Africa, with more recent work in India and Indonesia, looking to further expand successful self-testing strategies to more people. Data recently collected jointly by UNITED and the World Health Organization show that between 2015 and 2020, the number of countries with self-testing policies has grown from 6 to 88, and an additional 31 countries have policies in development. Eastern and Southern Africa, the epicenter of the HIV epidemic, are now leading the way with 52% of all countries implementing HIV self-testing, more than any other region. In contrast, significant gaps remain in Asia and Latin America, where just 10% and 6% of the countries are implementing HIV self-testing respectively. HIV self-testing has helped reach populations, including men and young people, who are less likely to access health centers and at significantly lower testing rate. In the largest evaluation of self-testing to date, UNITED's flagship STAR initiative found that in Malawi, Zambia, and Zimbabwe, close to half of all self-testers were men, and more than 1/3 were population between the ages of 16 to 24. Key populations who may hesitate to visit health centers due to the stigma or discrimination, including men who have sex with men, transgender individuals, and sex workers, have also benefiting from self-testing. In West Africa, the UNITED-funded Atlas project targeted those groups by making self-test available in places they frequent, such as nightclubs, hotels, or via personal contact. With, and that's an important number, more than 40% of all people reach getting tested for the first time. While procurement of HIV self-test is rising, it is greatly outpaced by the need. Ahead of World AIDS Day, December 1, UNITED is calling for urgent funding and scale-up of HIV self-testing to protect progress undermined by COVID-19 and secure pathways to HIV treatment and prevention for millions of people worldwide. A test like this costs now $2, thanks to the intervention of the Gates Foundation and UNITED. A test like this costs now $2 in low and middle income countries, which is quite amazing and so easy to use. People need to know the status, and if that can help people to know the status, that should be used more widely. Thank you.
Thank you very much. Sorry, Hervé, and indeed, as you know, 1st of December, World AIDS Day, and we also have just an announcement on this from Sophie Fischer for ILO. Sophie, are you connected? Can you just tell us about your publication of your report ahead of AIDS Day?
Unmute. Yes, thank you very much. Yes, picking up on the theme of World AIDS Day next week, the ILO will be publishing a new report on the levels of stigma and discrimination faced by people living with HIV and AIDS. We will be publishing the report on Tuesday, the 30th of November. The report has been prepared in collaboration with Gallup, who are a global analytics and polling organization, and they have gathered data for us in 50 countries worldwide. The report is titled the ILO Global HIV Discrimination in the World of Work Survey, and it looks at causes of persistent HIV-related stigma and discrimination and makes some recommendations for change. Excuse me. That was an ordinary cough. Now, for UNOG accredited correspondents, an embargoed virtual press briefing will be taking place on Tuesday, the 30th, from 1400 to 1500 Geneva time. Login details will be sent to you in advance. The embargo will lift at 1500 Geneva time. The findings of the report will be presented by Chidi King, who is Chief of our Gender Equality, Diversity and Inclusion branch, and from Gallup, Andrew Dugan, who is a Gallup research consultant. Of course, as usual, embargoed copies of the report and the press release can be made available on request in advance, and recordings of the briefing will be available after the press conference. For further information and to arrange interviews, please contact us. You know where we are. Thank you.
Thank you very much, Sophie. And I see John Zarokostas has a question, probably with Hervé. John?
Yes, good morning, Hervé. Can you hear me there?
Good morning, John. How are you?
Yeah, fine, thanks. I was wondering, you mentioned that the tests will be available for $2. Given that the countries that you're targeting, at least in sub-Saharan Africa, are extremely poor and suffering from the COVID situation as well and the economic meltdown, why isn't the Gates Foundation and the ministries of health of these countries distributing the tests for free?
It's a good question. The test is free. $2 is the cost. The test is free for the final user in many, many countries. For example, United is investing a lot to have those tests distributed in Southern and West Africa. Then that's a lot of countries where that's distributed for free, meaning that the government don't pay them because it's paid by other organizations. But I must say that we have for the moment a 100 million gap for the next few years, just to ensure the procurement of what has been ordered by countries, meaning that we urgently need additional funding. And one more time, we are talking about COVID-19, and that's a time where people are not going easily to the hospital or to health facilities to test themselves, and then self-testing is very important. And that's very accurate, by the way. Those tests are very, very accurate.
Thank you, Hervé. Any other question to Hervé or Sophie on AIDS? No, so thank you very much. Have a nice flight.
Merci.
And I'll turn to my left to Thompson, who has an update on Ethiopia. Thompson, welcome.
Thank you, Alessandra. Bonjour à tous. Very good morning to you all. Indeed, we do have an operational update from Ethiopia, where the situation is no better than the last time I briefed you on Tuesday. The number of people in need of humanitarian food assistance across northern Ethiopia has grown to an estimated 9.4 million as a direct result of ongoing conflict. Amara region, the front lines of the conflict in Ethiopia, has seen the largest jump in numbers, with 3.7 million people now in urgent need of humanitarian aid. Of the people across northern Ethiopia in need of assistance, more than 80%, equivalent to 7.8 million people, of them are living behind battle lines. It is vital that food assistance can cross battle lines to reach families in need. The nutrition situation is no better as well. Across North Ethiopia, it is fast deteriorating, with screening data from all three regions showing malnutrition rates between 16 to 28% for children. Even more alarmingly, up to 50%, half of pregnant and breastfeeding women screened in Amhara and Tigray were also found to be malnourished. Now, let me just give you a couple of figures to jog your mind. In Tigray, screening data shows wasting in children stands at 16%. In Amara, over 20% of children were acutely malnourished. In Afar, the global acute malnutrition rate in children was over 30%. In all these three regions, more than 50% of the pregnant and breastfeeding women were also malnourished. Now, under normal circumstances, an acutely malnourished child is 9 times more likely to die. This is a tragic statistic that will only worsen in conflict settings. Now, what have WFP been doing in all this? I briefed you on Tuesday saying that this week we were going to scale up assistance in Amara towns of Desi and Kombolcha. We have been able to deliver food to over 10,000 people in those 2 towns. These are the first distributions to happen in these towns since they were taken over by Tigray forces almost a month ago. WFP was only granted full access to its warehouses in the region last week. To date, WFP has reached more than 3.2 million people with emergency food and nutrition assistance across northern Ethiopia, including 875,000 vulnerable mothers and children with nutritionally fortified food in Tigray and Amara. Some of you may have heard, the United Nations Humanitarian Air Service flights into Tigray resumed on Wednesday, rotating the first humanitarian workers into and out of the region since a security incident on 22 October. Now, we have made a couple of gains, but we still need additional support. The World Food Programme needs 1 million liters of fuel to be able to reach the 7.8 million people who are currently behind the battle lines and in urgent need of food assistance. Tigray authorities have made fuel available for WFP in Kombolcha town with an initial batch of 45,000 liters already on its way to support the scale-up of food assistance in Tigray. A convoy loaded with 2,200 metric tons of life-saving food is expected to arrive in Mekele in the coming days. 35 trucks have arrived so far. In addition, trucks loaded with food from Kombolcha are being sent into southern Tigray today. But corridors into Tigray had been closed due to recent Tigrayan offenses in Afar and Amara, as well as severe disruptions in clearances from the federal government. Now, since mid-July, less than a third of the supplies required to meet estimated humanitarian food needs have entered the region. In this current round in Tigray, the World Food Programme has reached 180,000 people, which is just 7% of the 2.5 million WFP needs to reach. In Amara, WFP has reached more than 220,000 people with food and nutrition assistance, and we are scaling up in the entire region to reach 650,000 people. Similarly, in Afar, WFP has distributed food to 124,000 people out of its targeted 534,000. Now, I realize there are quite a number of figures, but this operational update is yours in the next 10 minutes. But I want to end by saying, it's been a year. When this conflict started, we said it was dire. 6 months into it, we said it was catastrophic. 3 months ago, I warned that the West was yet to come. Today, 9.4 million people are living their West nightmare. It has become their daily lived reality. I come back to you again, and I count on the support from the media. The World Food Programme is 100% voluntarily funded. That means we fundraise on the go. WFP needs 316 million to deliver assistance over the next 6 months. We appeal to donors who have supported us over the past year to continue to dig deep and to come through for us at this hour of need for both WFP and the people of Ethiopia. Across the entire country, WFP has an unprecedented funding gap of 579 million for us to be able to reach 12 million people over the next 6 months. Thank you.
Thank you very much, Thompson, and let's hope that your appeal is heard. I see John has a question.
Yes, good morning. My question is to Thompson, but also to other press officers might be listening in or present, whether it's OCHA or the Office of the High Commissioner for Human Rights. Thompson, just hearing your briefing, it's very clear that the various warring parties are blocking the distribution, not only the Ethiopian government, but now you're mentioning also the Tigrayan forces. My question is the UN collecting names of officials from the warring sides that are blocking the humanitarian assistance, of which one diplomat described that earlier this week as de facto humanitarian siege? And would these people down the road be liable for possible prosecution for war crimes?
I would like to defer to other colleagues in terms of whether we are monitoring and collecting data and names. But what I can tell you is that some of our activities, for example, the logistics hub in Kombolcha has been needlessly targeted during this bitter conflict. I will look to other colleagues in the room to see if they can also add.
Yeah, indeed. I think, John, this is really a question for human rights, and today they are not connected. No, so we will have to ask them the question. But please have a look also to the various. There has been a lot of statements by different bodies of the human rights bodies about the issues, about the situation in Ethiopia. So I would also invite you to have a look at that, but we will take your question to Rupert. Let me see if there is any other question. Yes, John, you have a follow-up? And then I go to Peter.
Yes, Alessandra, if you can get something from the Secretary General's office in New York or the legal counsel, that would be helpful, and relay it back to me and to others in this call. I think it's of general interest, but this issue is in the public domain. That's why I raised it.
Indeed, I'll try to get you something. Although today I think is their long weekend with Thanksgiving, but I'm sure there will be somebody to answer my question. And if I get any answer, I'll bring it to you. Peter.
Yeah, thanks. Thompson, I'm just wondering, the situation in Ethiopia sounds pretty dire. And the last time that I think that Ethiopia was in such a situation of famine was in 1984, when a huge number of people were affected. Is this situation comparable to that?
I'm smiling because I was not yet born, but what I can tell you is that the situation is quite bad. We have not, a famine has not yet been declared in Ethiopia, but the suffering of people is quite, I mean, you used the term of dire. It's, we are running out of words really to capture exactly the situation that is unfolding before our eyes. But what I can tell you, it is the textbook definition of a humanitarian crisis.
Thank you, Thompson. Just to come back to what John was asking, I would also like, John, to invite you to have a look. The report that was published on the 3rd of November by the Human Rights Office and the Ethiopian Human Rights Commission, among many, many other issues that they are detailing here. They're also detailing the specific impact of the conflict on the denial of access to humanitarian relief. So there is a specific mention of that. But as I said, I'll bring your question to Rupert. If there are no other questions for Thompson, and I don't see any, let's stay on the humanitarian with Jens. Jens, you have 2 points, Cameroon and an announcement, please.
Thank you, Alessandra, and good morning, everyone. Let me start with a note on Cameroon. The humanitarian coordinator in Cameroon has condemned an attack on a school in the southwest region, which led to the death of 4 students and a teacher. On the 24th of November, unidentified gunmen attacked government bilingual high school in Ekondotiti in Cameroon's southwest region. 4 students between 12 and 17 years of age and a teacher were killed. A number of other students and teachers were injured. The humanitarian coordinator, his name is Matthias Nab, said in a statement that attacks on schools, teachers and children are serious violations of international human rights law and of the right to education. He said that perpetrators of such heinous acts and those supporting them must be held accountable. Attacks on education in Cameroon is tragically an issue since the crisis turned violent in 2017 and continues in the northwest and the southwest regions. School facilities have been targeted with arson and students and teachers killed and maimed. They are also frequent victims of abduction. In June, students and examiners taking part in the General Certificate of Education exam were attacked by non-state armed groups in several locations. Again, in late October, partners reported the kidnapping of 3 children on their way to school in Mulang in the northwest region. Other kidnappings in that area have been reported with children reportedly still held in captivity. Improvised explosive devices, what we call IEDs, are also frequently used by non-state armed groups. On the 10th of this month, an IED injured some 11 students in the amphitheater of Buea University in the southwest region. Humanitarian access across these regions are severely hampered by the insecurity. Military road closures also occasionally affect operations. In conclusion, 2 out of 3 schools in the northwest and southwest regions remain closed, depriving 700,000 students of their education. Thank you.
Thank you very much, Jens. Let me see if there's any question on Cameroon in the room. No. Yes, go ahead, Hassan.
Do you have any updates about what is going on in Darfur in terms of humanitarian situation?
Let me see if there's any question on Cameroon first, but I don't see any. So maybe you want to answer on this?
Yeah, I don't have a specific briefing on Darfur with me, but let me look it up and I will share that with everyone.
Any other question? Any other question to Jens? Katrine.
Yes, good morning, Jens. A stupid question, I'm sorry. Who is the coordinator for the moment in Cameroon?
No stupid question, no?
Well, no stupid question. So
there are no stupid questions.
His name, I think I mentioned it, is Matthias Nab, N-A-A-B. He's a humanitarian and resident coordinator.
Thank you. I don't see any other hand up. So, Jens, maybe you had an announcement also.
Yes, thank you. So this is about the Global Humanitarian Overview. So OCHA will launch our annual Global Humanitarian Overview, which is an assessment of global needs and how we plan to respond in 2022 on Thursday, the 2nd of December in the Tempus 2 room here in the Palais from 9 a.m. The launch of the GHO is hosted by Emergency Relief Coordinator Martin Griffiths, who will be here in Geneva, and several high-profile guests will deliver remarks and participate in a panel discussion about the changing humanitarian landscape in a time of climate change. The launch is hybrid and will be webcast on UN Web TV. After the main launch here in Geneva in the morning, there are sequential presentations in Berlin, Brussels, London, Stockholm, and Washington, D.C. over the coming hours of that day. The report itself includes humanitarian trends and projected needs in 2022, how to respond to them, and what it will all cost. It will be posted online, the document itself, at 6 a.m. Geneva time on the 2nd of December. And I have put a link in my note to you where that will be. Just to remind you that the current Global Humanitarian Overview for 2021 is there right now. It will be replaced on the 2nd of December in the morning. Correspondents here in the Palais, you will get an embargoed copy in advance of the launch next Thursday. And we will have an availability with Martin Griffiths on the 1st of December. I will send you a separate note on that. Thank you.
John.
Yes, good morning, Jens. It's interesting that you're launching it between two summits here in Geneva. But anyhow, my question is, in previous years, sometimes this overall appeal doesn't include some countries and then they're added later. Which countries are not included in this humanitarian appeal this time round?
Maybe, John, can you repeat your question? It came broken. Did we lose you?
Can you hear me now?
Yeah.
Am I broken record now? Okay.
No, you're not. Go ahead.
Okay. I thought I was. Anyhow. Yes. My question is, in previous launches, it was not complete. There were some countries that you added a few months later. Is that the same situation this time round? And which are the countries to take into account?
Yeah, thank you very much, John. It is the case that many of the individual humanitarian response plans and regional response plans are not fully fleshed out at this point. And they will come, they will be published as and when they are finalized and have been signed off by a large number of people who need to look at this. That does not prevent us from having this overview, and it is an overview where we summarize what is the situation in the various crises, what are the needs of the humanitarian community in order to respond, and we will attach a dollar figure to that. So you will have all the crisis situations that the international community will respond to in 2022 at the beginning of 2022, because more may be added in the course of the year, of course. They will all be represented in there.
Thank you, Jens, and I don't see any other hand, so thank you very much. So let me go to my left. You will recognize an old friend who we haven't seen for a while, Matthew Saltmarsh. Matthew has disappeared for a while to come back in a new function, and I'd like to congratulate him for that. He is the new head of news and media of the UN Refugee Agency, and it's in this role that he's coming today to brief you together with his colleague Philippa Candler, who is the UNHCR representative in Panama. So she's going to talk to us about Guyana. But Matt, you want to start maybe?
Well, just to introduce myself to the Palais Corps, as mentioned, I'm Matthew Saltmarsh. I'm the new head of news at UNHCR, the UN Refugee Agency, and I've just come here from 5 years working for the agency in London. Some of you I met on previous stints here, others I'm looking forward to meeting. I will now pass the floor over to Philippa Candler. She's going to brief the Palais today on our concerns about living conditions of indigenous Venezuelans in Guyana. Philippa is an almost 30-year veteran of the agency. She's worked in multiple conflicts around the world. She's currently our representative of our multi-country office based in Panama. So Philippa, over to you, and thanks for taking this briefing.
I think we are trying to unmute you, Philippa, but you also have, okay, now you're on, go ahead.
Good morning. Can everybody hear me? I can't hear you anymore. Could you nod, Matt, if you can hear me?
We can actually hear
Thank
you,
very
but
much.
a little
Sorry
bit
about that.
far. I don't know if you have,
I'm
you can.
the UNHCR representative in our multi-country office in Panama, also covering Guyana, where I've been since Tuesday. UNHCR, the UN Refugee Agency, colleagues and I are worried about the difficult living conditions of the indigenous Warao families from Venezuela who are settled in remote locations across Guyana. Increased humanitarian presence and timely support from the international communities needed to help the government of Guyana respond to the needs of these communities. Guyana, as some of you may know, is home to an estimated 23,000 refugees and migrants from Venezuela, including some 2,500 indigenous Warao. Some have settled in hard-to-reach areas near the Venezuelan border. In northern Guyana, a community that I'm heading to later today. More than half of this group are children. Access to services for these communities is limited and the delivery of aid is impeded by remoteness.
There is a delay.
Infrastructure and distances. Assessments conducted in October and November among Warao refugee and migrant households indicate mounting needs aggravated by the economic downturn caused by the COVID-19 pandemic. Most Warao only have one meal a day or less. They lacking informal job opportunities. Many of them mention resorting to begging, working in odd jobs, often in exchange for food, selling handicrafts, or depending on humanitarian assistance. Most families don't have access to drinking water. They rely on rivers for drinking, but which they also rely on for bathing and defecation. Last week, my UNHCR colleagues received reports that one Warao child from the Anabisi community had died and several others were hospitalized, reportedly due to malnutrition and diseases related to poor sanitation conditions. Some of these children have since been discharged from hospital after being treated. UNHCR is on the ground, coordinating with the government and humanitarian partners on how to best support the government-led response. UNHCR is also delivering food hampers, solar lamps, mosquito nets, water purification tablets provided by the Guyanese Civil Defense Commission and other basic relief items to some 400 indigenous Warao from Venezuela living in northern Guyana, including those in the Anabisi community. Together with partners, since 2019, we've been distributing material assistance, providing shelter and support to access education services to refugees, migrants, and members of the host communities in this region and in other parts of Guyana to help improve living conditions. UNHCR also provides counseling, interpretation services, and facilitates their access to government services, including health programs and vaccination against COVID-19. Across the region, UNHCR supports national efforts to provide adequate shelter and access to food, strengthen their leadership structures, preserve their identity, and protect their traditional knowledge and cultural heritage. Can you hear me? In the framework,
it is really a little bit difficult, Philippa, but it is really a little bit difficult to...
Maybe I will end with one other sentence.
Yes, please. And maybe then we will ask questions to the questions to the journalists will address to Matt. Go ahead.
Okay. I mean, just to mention that, of course, all our activities in Guyana in the framework of the refugee and migrant response plan for the needs to meet the needs of Venezuelan refugees and their host communities in 17 countries across the region. This response plan is only 43.6% funded to date. There will be a new appeal for 2022 launched on the 9th of December. So just to mention here the previous parts quite clearly.
Yeah, Matt, maybe I'll ask you to answer the questions because I've got the messages here from the journalists that they say with the birds it was really difficult to hear. So if you have not understand something or if you have questions, please, colleague, let ask them. And Matthew is here to answer. And I see John has raised his hand.
Good morning. I'll wait for Paula to ask the question. Mine is not on Central America, so I'll wait.
Thank you. Paula.
Yes, hi, good morning. It's for the New Humanitarian. I just wanted to know if you may have a number on the total number of indigenous people who have fled Venezuela. There has been also the case in Western Venezuela of Wairu'u indigenous people fleeing into Colombia. I wanted to know also if there may be some fleeing southward into Brazil. And also, yeah, as the connection wasn't that great, I don't know if you could specify what sort of medical conditions you may have seen in those indigenous people in Guyana, and also those that were affected that you had actually observed as being in bad condition. Were they recent arrivals, or were they people who had already been there?
Let me try and answer the first part, and then we'll see if we can maybe get Philippa back to give you a bit more detail from the ground. I don't have an overall figure for the region of the Warao population who have left Venezuela. The estimate inside Venezuela is between 40 and 50,000. And then in Guyana, the estimate is 2,500, as was mentioned. I don't have a figure for the entire region, but I'll find that and get back to you on that. In terms of more details on the medical state, I would have to defer to Philippa, who's on the ground there, and I don't think she's able to come back. So let me get that back to you as well after this.
Antonio, Efe.
Hello, good morning. I just want to ask Philippa to send us the notes that she read, because we couldn't understand a lot. Thank you.
Absolutely, that's understood, and they're published now or very soon, and we'll get them to you. Thanks.
John, can you ask your question about other refugees?
Yes, good morning, Matthew. I was wondering if you could bring us up to speed on what UNHCR is doing with the situation of asylum seekers and refugees trying to find their way to the United Kingdom from the French coast. If you have the numbers, how many you think are being processed in France? How many are being processed in the UK that have successfully made it over the channel? And what is the UNHCR office in London and in Paris doing? And if you can give us the numbers, because I think there's confusion. Some people think they're all migrants, but I understand quite a few are asylum seekers and refugees as well. Can you clear the air there? Thanks.
Thanks, John. I mean, I think the first thing I'd say is that the events that we saw the other day are truly tragic, and of course our hearts go out to the loved ones of all those who have lost their lives. And it was an unprecedented event in the Channel, and of course we hope it drives concerted action, but sadly it's all too common in other parts of the world, especially in the Mediterranean. In terms of the numbers, we at UNHCR don't actually have those numbers in the UK. We've seen reports that are suggesting that 25,000 have crossed in small boats to the UK this year. But those are Home Office numbers and they're UK numbers. And likewise, we don't have a precise estimate of the numbers who are over in Calais in that region at the moment. As you know, there have been various operations to try and move asylum seekers and migrants on. And we haven't actually had a direct mission there in the last days. I might just add though, John, in terms of solutions, obviously we think it's important that there is a concerted effort to try to crush the smugglers' rings. The smugglers have been very adaptive in the recent months. It's very important also that information is provided to those who are on the coast in northern France about the risks, the really real dangers that they will have if they cross the Channel. And of course, we say that it's very important, specifically in the UK context, that there are fast and fair asylum procedures. The system has become a little bit silted up in recent years and months, and that hampers solutions. The other thing that we would add is cooperation between the two countries, but also between the UK and Europe is extremely important. And then, of course, safe and legal routes. Safe and legal routes are essential, and they can be an important means of people avoiding having to take these precarious journeys. And we know that particularly in the case of the UK, the numbers who have been able to benefit from programs like resettlement and family reunion have declined recently, partly as a result of COVID.
A follow-up, John?
Yes, Matthew, if I could come back on the data, what's the reason both France and the UK are signatories to the 51 Convention? Are you asking for the detailed information and the member states are not providing it? Or what seems to be the problem? It's highly unusual for UNHCR that's got precision down to the last human being on the ground, not having the data in these two cases.
Thanks, John. We know the numbers of asylum seekers in the UK. We know the numbers of asylum seekers in France. But because this situation is fluid, is changing day by day, some days there are hundreds crossing. There were reports that one day there was over 1,000 crossing. We're not actually monitoring day by day those numbers. So those questions would have to be referred to the Home Office in the UK and the Interior Ministry in France. But we do have the annual figures, of course.
Thank you very much, Matt. And I don't see any other question. And yes, if you could send the notes, Philippa notes, that would be very, very useful. Thank you very much. Just a little bit of housekeeping. I know you were waiting for Christian. He's just arrived, but we have a last announcement from Sarah, a short announcement, and then we will go to WHO. So, and that will be our last speaker. So Sarah, you want to briefly announce something about the Building Bridges Week?
Yeah, exactly. So in the context of a Building Bridge Week, we have our UNDP Geneva flagship event that is focusing on SDG finance. Just to remind you that the financial needs to achieve the SDG in developing countries have skyrocketed with COVID. I think the OECD estimates that the needs are up to 4.5 trillion a year. And one way to redirect mainstream capital flows is to identify a pipeline of bankable companies working on product and services that focus on impact and the bottom of a pyramid. And it's exactly what we're doing. So to serve that purpose, 15 entrepreneurs from 10 developing countries identified through a UNDP program, which is called the Growth Stage Impact Venture, and working on access to quality health, clean energy, and waste management, will come to Geneva next Thursday, and they will pitch in front of investors, large corporate, development organization, and they're obviously looking for partners to scale up their product and serve more beneficiaries. So the 15 enterprises are all mid-sized with an average of up to 100 employees. They have an annual revenue between $500,000 and over $5 million. And altogether, they represent an investment opportunities of about $48 million. And they also impact the lives of about 1.2 million people in developing countries. Just to give you an example, because there are some really good stories there. Like we've got, for instance, Benpu Health in India, and the company delivers life-saving technology intervention such as a neonatal bracelet that monitors newborn's temperature. And you need to know that like one of the big cause of infant mortality in India is hypothermia. So that's like a direct solution. And this is like a very financially very successful companies. So we've got 15 examples of a type coming to Geneva. What is really interesting is that these entrepreneurs demonstrate that there's a business case for the SDG in developing countries. So we're not talking about philanthropy. We're really looking at entrepreneurs who are changing the landscape of access to healthcare, clean energy, and waste management in Africa, Asia, and Latin America. But also they are really interesting investment opportunities. and they can really support that redirection of mainstream capital flows towards sustainable finance. So just let me know if you have an interest to meet with some of them, and I've added the profile of those entrepreneurs in the notes that you're going to receive. Over, Alejandra. Alessandra.
Thank you very much. I see John has raised, no, sorry, John has put it down. Paula.
Yeah, hi again. So I just wanted to know that this Building Bridges conference is largely sponsored by Swiss banks. And, you know, given the fact that you're going to be, you know, that the idea is to listen to them, to get their, you know, get them to finance a lot of these programs, sustainable programs. I just wanted to know whether UNDP finds that the Swiss banking sector is doing enough to promote diversity within its ranks. That's of course going to be reflecting in the sort of investment decisions that are going to be made in this area.
Sarah?
So, yeah, Paula, my first comment is that I'm not a spokesperson for the Building Bridge Week. I know that you're attending, and there will be some press conference every morning. I guess the Monday morning would be the right moment where you can ask that question regarding UNDP. So we have different ways of working with the finance sector, including the Swiss finance sector, and at different levels. Because if you want to unlock mainstream capital flows, you need to work on the pipeline, basically on the supply and demand, but also on the standard and the transparency issue, which is, I think, at the core of your question. One of the ways we work on that is to work with many different organizations on standards so that institutions like the Swiss financial institution can really track and then also you know, disclose how they invest. And I think this is also the role of civil society to request for more disclosure. And that's one of the key topics of the Building Bridge Week. But once again, I would encourage you to ask that question directly also to the organizer of the Building Bridge Week.
Thank you very much, Sarah. And indeed, we have distributed already quite a few information on the Building Bridges Week, which is co-organized by the Sustainable Development Goals Laboratory, SDG Lab of the Office of the UNOG Director General. And as we have also announced, the Deputy Secretary General will participate in some of the events at the beginning of this important initiative, in particular the summit of 2021 here in Geneva. And if you haven't received it, of course, all the information is available, and there is also a website which is called buildingbridges.org with all the program and the information on how to register. John, is that for Sarah? Otherwise, I really want to go.
Yes, it is for Sarah. It's for Sarah. It's for Sarah.
Okay, go ahead. It's your day.
Yeah. Yes, Sarah. Has there been a response from the Office of the Executive Director to the press release by a group of eminent human rights NGOs, including Amnesty and Human Rights Watch, that your report on Egypt was flawed?
Sarah?
Yeah, I think I'm going to take that as a, I'm going to follow up with you, and I'm going to connect you to Dylan, who will provide the statement on that issue, if you don't mind.
Thank you very much. And so now is definitely, last but not least, Christian, who has just joined us in person, which I'm very happy to see that we have a WHO person in us at the briefing, and you have an important update on this new variant B.1.1.529.
Exactly, but and that if that doesn't merit being here in person, I don't know. But let me first remind everybody that Monday morning starts the WHO special session of the World Health Assembly. It lasts 3 days from 29 November until 1 December. And with only one agenda item, as you know, considering anything what is labeled so far as possible development of a pandemic treaty. In parentheses. The meeting starts at 10 o'clock on Monday morning with the opening session, welcoming speeches and other high-level speeches. The detailed agenda is not yet finalized, but everything you can find on the web, the links have been sent around, and all 3 days of sessions will be webcast. So that's that, and as you may imagine, it seems like a very timely event to come. Now on to what's making the news right now. WHO is closely monitoring the recently reported variant B.1.1.529. I repeat, WHO is closely monitoring the recently reported variant B.1.1.529. WHO is convening a meeting of the Technical Advisory Group on Virus Evolution, so-called TAG-VE, today, actually starting noon Geneva time, which is in a short moment, to better understand the timeline for studies that are underway and to determine if this variant should be designated as a variant of interest or a variant of concern. The terms of reference of the TAG-VE can be found on our website. Early analysis show that this variant has a large number of mutations that require and will undergo further study. It will take a few weeks for us to understand what impact this variant has. Researchers are working to understand more about the mutations and what they potentially mean for how transmissible or virulent this variant is, and how they may impact our diagnostics, therapeutics, and vaccines. This variant, the B.1.1.529, was reported at a remarkable speed. The first sequence was reported on 11 November. We are grateful for the researchers in South Africa and the experts on WHO's TAG group on virus evolution who are working on this. The detection of the variant means that the surveillance system is in place and is working. It is again really outstanding how open and transparent this was, and these findings are really important. After the meeting of the Technical Advisory Group on Virus Evolution today, we will inform you whether the variant is going to be classified as a variant of interest or concern. And we will share any relevant information soon as after. We will also share further guidance for governments on actions they can take. While this is ongoing, it's important to remind ourselves that there's a lot we can do at this right moment before we even know much about the virus or about this variant to protect ourselves. First, the more COVID-19 circulates, the more opportunities this virus has to change, to mutate and develop different forms. It is essential that we all continue to work to reduce the circulation of COVID-19. We need more people to be vaccinated everywhere, and we each need to take all the other measures that are out there to protect ourselves. That starts with the masks, avoiding larger gatherings, hand hygiene, ventilating rooms and meeting rooms whenever possible, and so on and so forth. So these are the measures that we know work, and these are the measures that we know will continue work, even if we don't know yet exactly the details of this variant. We need to further reduce our risk of exposure and prevent ourselves from passing the virus, the COVID-19 virus, from one to another. I'll leave it at that for now.
You won't, because there is a serious question long like this. So we start with Gunilla.
Thank you. Thanks for taking my question. But as you know, there are very strong reactions surrounding this new variant. Would you be able to say in any way how worried people should be? And when do you expect to have a decision if this is a variant of concern or interest? Today or in a couple of weeks? And perhaps also, could you say something about the several countries imposing now travel restrictions before we know if it even is, how dangerous the virus is? Thanks.
Many questions in one, Christian.
Thank you very much, Gunilla. I guess that sums up most of the questions anyway. Well, let me start with the meeting as such. The meeting, I don't know how long it will take today, but the decisions on that part, I'm pretty sure will come out today, and we will communicate right afterwards. I cannot give you a timeline, but the meeting is starting soon, and in a couple of hours, we will be ready to communicate the outcomes, or we'll do it as soon as possible afterwards, of course. Now, to your question whether people should be worried. Again, while a variant develops when it can, there are a lot of things we can do to protect ourselves at this very moment. I will repeat. Wear the mask whenever possible. Even if you look around the room here, everybody in this room where we're sitting right now who's not actively on the podium is wearing a mask. When you meet people in the hallways, they're meeting a mask. So keep wearing your mask whenever possible and appropriate. Avoid larger gatherings when possible. Ventilate rooms to make it harder for the virus to settle and to transmit, and keep an overall hygiene, hand washing, and all the measures that we know. We know they work. We know they reduce transmission. That is important, and this is what we can do today. Let the experts have a work on this, and this will take a few weeks to determine exactly the details about this variant, the transmissibility, whether it's how contagious it is, and so on and so forth. So this will take a few weeks. Again, let's not forget, only 2 weeks ago, on the 11th November, was this first isolated, and it's really remarkable that we are at this stage already today to talk in details about it, but conclusions will not be over today, not be finalized today. On travel restrictions, yeah, I think that's another part here. Also here, countries can do a lot to work on surveillance, on sequencing, and collaborate with the affected countries or with other countries to work scientifically, globally on fighting this virus and this variant. But WHO recommends that countries continue to apply a risk-based and scientific approach when implementing travel measures in accordance with the temporary recommendations of the 9th Emergency Committee.
Thank you. Antonio.
Good morning. So given the high interest on this meeting, can WHO broadcast maybe the initial remarks on the meeting through Zoom or in YouTube channel? Thank you.
Thank you. It's a technical expert meeting, and it is a closed meeting as always. But we will do what we can afterwards to give you any findings, any report. We don't know the shape yet how this can be done because it's all only developing, as you know. But no, the meeting itself is a closed meeting.
Peter.
Thanks, Christian. This variant, which was discovered in South Africa, was which actual Southern African country was it found in first? Do you know that?
To my knowledge, it was actually in South Africa because the researchers in South Africa and the experts of the technical advisory group are currently assessing this variant. But yeah, that's what I have.
Nick.
Yeah, hi, Christian. Very simple question, really. Is this taking place in Geneva or in South Africa? And are you expecting to have a press conference at the end of it, or will you simply be limiting yourself to a statement of the results?
Thank you, Nick. So this is one of these typical meetings we have nowadays in the COVID scenario. It's been held virtually from Geneva. Those experts who are in Geneva will be taking most likely part from here, but many will be linked in virtually from around the globe because it's a technical advisory from experts available that are not only WHO experts or actually rarely, and hence they're being brought together virtually to convene on this. Yeah, again, what we do afterwards, most likely, as it's a developing thing, a press conference I see at this point unlikely, but there are still a few hours and we see what we can do. again, most likely rather in form of a statement, broadcast statement, or a recorded statement, or even in a written form. Press conference, I see at this point unlikely.
Nick, as a follow-up.
Yeah, and just to be clear, I mean, there will be a determinant as to whether this is a variant of concern or not at this meeting. That will be decided now.
Correct. That's the understanding I have, that one of the goals of this meeting today is to designate whether this will be a variant of interest or a variant of concern.
Laurent?
Yeah, thank you for taking my question. That's rather on the special session. It's still not clear to me how many, for the high-level segment on Monday, how many health ministers are coming physically to Geneva, or most of them, are they going to speak remotely? And which room will the high-level segment take place in? Thank you.
So thank you. Yes, this is a hybrid session, as we call it, that some will join, and I don't have figures. We don't have figures yet in general, and many will join remotely, certainly. It will be held in a new room in the new building. It's the auditorium. So I haven't even seen it myself, so it will be the first time that this room is being put to test for these procedures. And yeah, we will see at the very last moment, because there's also the WTO meeting ongoing, and so there might be a certain spillover effect in terms of ministers or delegations joining from here or there, but we do not have a confirmed number.
And I would take this opportunity, Laurent, to also inform you all that because of what Christian just said, not only the special session of the WHA, but also the ministerial conference of the WTO, the Director General of UNOG has decided to ask the staff next week to telework unless they are asked to be here for essential purposes in order to reduce the footprint of the people coming to Geneva. So the Para is not closed. Your offices will be available. You can come, but you will see a little bit less staff around because we are asking people to work from home if possible. For what concerns our work, the briefing for the moment, we keep it in person. If there is any change, we will inform you. And I see Laurent has a follow-up.
Yeah, thanks. So as it is in that auditorium, the new building, what are the arrangements for us and for the photographers? Could some of them get in?
So in line with what Alessandra just said for the Palais, we have similar arrangements that most of our staff, all who are not directly involved with the assembly session, are actually requested to work remotely because of the COVID situation. And what we have set so far up is we contacted the agencies in Cameroon for pool arrangements. We have space and got arrangements for 6 journalists in a pool arrangement to join, and with the arrangements that are common with the Palais. And thank you, Alessandra, for facilitating this. So again, the agencies and Cameroon have been contacted. Mind you, and this is really important, the access at the assembly is extremely limited. So even these pool journalists will not have direct access to the assembly hall, to the auditorium, which makes it really difficult. So the best you can get actually is the live feed from our technical units, and the same for the pool photo. It's really extremely difficult this year, more than any time before. Yeah, that's the setup for now.
Robin.
Thank you. The decision on whether this variant might be classified as a variant of interest or a variant of concern, can you say a bit more about the basis on which that decision would be made? So what are the things that they will be looking at in order to make that decision? Thank you.
Yeah, thank you very much. I mean, they of course look at transmissibility and how much we know how it reacts to therapeutics or to vaccines. But more you will find in the terms of reference of the tag team, because we scrambled as much information as we had quickly to come here to update you. And again, this is an evolving situation. So even what we know today may change and develop in the next days and next weeks. So with the information that's available today, the recommendations will be made and the classifications, and again, it will be developing, but I'd invite you to please look at the terms of reference.
Jamie.
Good morning, Christian. I just wanted to follow up a little bit more specifically on what Gunilla had asked, particularly with the travel restrictions. We're seeing a number of European Union countries that are announcing restrictions or plans for restrictions, and even Health Minister Spahn spoke about this, specifically with regard to South Africa and Southern African countries. So could you just give us WHO's, last night Mike talked about a warning about knee-jerk reactions, particularly on the issues like travel. So could you just tell us what WHO's stance is on this type of travel restrictions, specifically in light of what's been announced this morning? Thank you.
Yeah, let me first maybe point out that nothing has been officially announced yet through our chains, but of course we all have seen the news and the updates that have been made. Let me reiterate the official statement I have here is that WHO recommends that countries continue to apply a risk-based and a scientific approach when implementing travel measures, in accordance with the temporary recommendations of the 9th Emergency Committee. And it is important to note that every travel measures should be always weighed, and that countries can do a lot already in terms of surveillance and sequencing, and work together with affected countries or globally to work scientifically to fight this variant and to understand more about it so that we know how to go about. So at this point, again, implementing travel measures is being cautioned against and taking a risk-based and a scientific approach.
John, sorry, Jamie has a follow-up. Jamie.
Sorry, Christian, I just want to make sure. So at the moment, given what you've just told me, and you talk about 9th Committee and all that, that can make people's eyes glaze over maybe. But can you, I mean, right now, you're not saying that the measures taken by European Union are unwarranted. Is that correct? That you're not...
Yeah, I know what you're after, Jamie, but I have nothing but the statement I just repeated.
John.
Yes. Good morning, Christian. Can you hear me there?
Yes.
Can you hear me? Oh, good. Yes. Coming back, when exactly did the WHO get notification of this emerging variant from the Global Alert and Response Network? When were you formally notified? And secondly, the briefing today, there's been some excellent material in the public domain from Professor Salim Karim of South Africa. So at the end of this, why can't we get a briefing from one of your eminent experts to walk us through this, since already the South Africans' most eminent professors have been in the public domain? It'd be nice to have WHO coming along to brief us on that, either virtually or whatever. It's a big issue.
Well, thank you for your concerns, John. First of all, I am here to brief you, and yes, understood. I'm not a technical expert and I'm not a professor. But we do what we can. It's 12 o'clock now. The TAG meeting is starting now, so you may understand that all people concerned are actually part of that meeting. We will do what we can to brief as soon as possible. The first sequence that you mentioned was reported on 11 November, and that's what I have.
And we have Ahmad.
Good morning, Alessandra. I don't know if you hear me.
We do. Go ahead. Good morning to you.
Good morning, Christian. It's just to ask a Christian if he can send us the briefing notes to our emails. Thank you.
Yeah, I'll share the briefing notes. Yeah, I think Dublin will give it to the Palais and we'll share individually as well. Yes, thank you for the reminder.
Very important. Okay, I don't see any other hand up. If this is the case, I would like to thank.
Just to repeat, to catch up on the point that John made. I mean, it is important for us all to understand this. So yes, we will try to get as much of a technical expert briefing as soon as possible.
Thank you.
And I caught you off guard now.
No, I'm looking for my paper. I can't find. Yeah, I can't find. Thank you very much. And really, I would like to thank Christian for having really come physically to the Palais to brief you, although at the end of the briefing, it was important, I think, to have this initial announcements, and thank you very much for being with us. I just have two quick announcements, just to remind you that Tuesday, 30th of November, 3 p.m., press conference from ITU. This is about the 2021 Measuring Digital Development Facts and Figure report. And the speakers will be Doreen Bogdan-Martin, who is the director of ITU Telecommunication Development Bureau, and Maria Francesca Spatolisano, Secretary General's Envoy on Technology. And then we have two committees that are the Committee Against Torture that will conclude this afternoon the review and report of Bolivia. And next Friday, this committee will close its 72nd session and issue its concluding observation of the 6 countries reviewed, which are Sweden, Kyrgyzstan, Nigeria, Lithuania, Serbia, and Bolivia. And the Committee on the Elimination of Racial Discrimination, which will close next Friday, 3rd of December, its 105th session, issuing the concluding observation on Switzerland, Singapore, Thailand, Denmark, and Chile. And please be reminded that next Monday at 1:30 p.m., the UN office at Geneva will host a special meeting for the International Day of Solidarity with the Palestinian people that, as you know, is commemorated on the 29th of November. And we have sent to you the message of the UN Secretary General on this International Day. I think I've told you everything I could. If there are no further questions, thank you very much for being with us for this long briefing. Bon appétit and have a nice weekend.